All right, I believe we are live.
Yep, we're good to go.
Okay, terrific. Good evening, everyone. Thanks for joining us tonight. Thanks for joining New Jersey Citizen Action. My name is Mara Collinsgrew. I am the Director of Policy and Advocacy at New Jersey Citizen Action. I'm really happy you could join us tonight for this discussion about the Inflation Reduction Act. Our goal tonight is to take you beyond the headlines to get a better understanding of what this historic bill does, who it will impact, how it will impact all of us, and why it is such a big deal. Tonight, we're really thrilled to have with us two of our national partners who have helped to lead the fight to win this historic reform. Briefly, by way of introduction, Margarita George is with us tonight. She has spent more than 25 years organizing for action, and trust me, she really does stir some action. Margarita is a well-known strategist, organizer, coalition builder, and a terrific resource and partner to groups like New Jersey Citizen Action all across the country. Margarita serves as the executive director of Healthcare for America Now, the nationwide campaign that passed, helped to implement and defend the Affordable Care Act this past decade, and campaign director of Lower Drug Prices Now, who has helped to fight for this historic prescription drug reform. She also serves as the co-chair of Americans for Tax Fairness, the other organization and national partner joining us tonight. Frank Clemente, the executive director and one of the founders of Americans for Tax Fairness, is here tonight to talk about the tax provisions in this historic bill. He too has led nationwide coalitions. He's been the campaign manager for the Strengthen Social Security campaign and has managed healthcare campaigns for our partners at the Communication Workers of America, and has done a lot in support of the Affordable Care Act. Like Margarita, he is a policy expert and advisor to many and serves as a resource to groups all around the country. It is those two who are experts that we hope you will learn a lot from tonight. So without taking any further time from this great discussion, I'm going to turn it over first to Margarita George, who will give us an overview of the healthcare and prescription drug provisions in this historic bill. Margarita?
Great. Thanks for having me, Maura. It's always great to spend time with New Jersey Citizen Action and your members and allies, and of course with Frank Clemente, my favorite DC colleague, let's just say it. So I'm going to share a little bit about the prescription drug reform provisions in the Inflation Reduction Act. These are really among the most popular provisions of this legislation. And for a lot of you all that do healthcare advocacy, you might, like myself and many colleagues that we work with, have spent really well over a decade now working on prescription drug reform. So this is a huge, huge victory. So let's move to the next slide. I just want to start with this slide because I think it's really relevant to what I'm going to say and even what Frank is going to say later in his presentation. But on the day that the legislation was signed by the president, there was a quote from the president's comments that I think really exemplify sort of a key dilemma that we have had in many, many years of trying to get prescription drug reform and essentially fight the prescription drug industry. You all know that industry very well. It's in your backyard. Many of the major corporations are based there in New Jersey. The president said, with this law, the American people won and the special interests lost. Now, that was not true across the board, but with respect to prescription drug corporations, it absolutely was true. They are going to be bad losers, and we expect that they're going to continue to fight to really try to roll back some of the important reforms that made history in this new law. Next slide. So here's a few things that are historic. You're going to hear about this last one from Frank later on in the presentation, and you're going to hear a little bit about climate change, but some of the most historical things in this bill are really changes to Medicare, improvements in Medicare that we've been trying to get for a long time. The biggest one is Medicare negotiation. So the ability of Medicare to negotiate lower prices for drugs in the Part D program. That provision of the law saves taxpayers about $288 billion. That $288 billion then is invested to lower costs, out-of-pocket costs for seniors in Medicare and premiums for people with private insurance. The other big thing in this legislation is the out-of-pocket cap on costs for seniors in Medicare. Keep in mind, this is a little bit shocking to say, but up until this point, there was really no limit on what seniors would pay out of pocket. If you've ever heard of the donut hole, right? That was a coverage gap in which seniors would have to pay 100% of their prescription drug costs out of pocket. So this has been a longstanding problem for people in Medicare and aging people. As they age and they need more medicines because they suffer from more chronic diseases, they are spending more and more, even though their incomes stay pretty fixed. So the cap and the first ever insulin cap, really historic in this legislation. Next slide. Here is more evidence of how popular, pretty much from over the last 2 years that we've been working on this legislation, poll after poll has told us that this is the most popular provision of the reconciliation bill. At some point, the reconciliation bill was called reconciliation bill. At some point, it was called Build Back Better. Now it's called the Inflation Reduction Act. But through every iteration, it's really been prescription drug reform that has been the most popular and, frankly, the easiest thing for people to kind of wrap their minds around. Next slide. I'm going to talk about two things, and we have found with our partners that it's useful to think about prescription drug reform in two ways. One is lowering prices. Lowering prices is about taking power from the industry. Right now, the industry really has monopoly power to charge whatever they want on brand name drugs. That's because they generally have exclusive patents and no competition. So they can set whatever price they want, and then they can raise their prices whenever they want. And of course, they do that pretty frequently. And that's one reason why even basic medicines like insulin are so expensive in the United States. So in this legislation, there are two things that really tackle prices, right? Two things that stop the prescription drug corporations from unilaterally setting prices. One is the prescription drug negotiations in Medicare. Seems like a simple thing, but really important thing. We already have it in the Department of Vets. We already have it in Medicaid. And the second are inflationary caps. This is a mechanism that penalizes corporations that raise prices faster than inflation. And the penalty is that they have to pay a rebate back to Medicare. And drug corporations raising the price of medicine faster than inflation is a pretty routine thing. They've been doing it for well over a decade. It's documented. Half the drugs in Medicare have prices that have gone up faster than inflation. And for anybody out there that's not on Medicare and just on private insurance, you've seen your prices go up, year after year, usually twice a year. The second thing is cost, right? So we have price and then we have cost. And the cost provisions in this bill are also really important. Now, cost is different because it's not about what the companies charge, it's about what people pay. And it sounds nuanced, but it's really not. We have to really tackle both to get to sustainable, affordable medicine for people. So in addition to those two really important things that lower price, that stop the corporations from unilaterally charging whatever they want, we have provisions that actually lower what people have to come up with out of pocket when they go to get their medicines. We have the first ever cost cap on what seniors pay out of pocket. It's going to be at $2,000 annually. About 1.5 million seniors paid more than that last year. So that gives you a sense of how many people are impacted. We have the first ever cap on insulin costs. That's $35 a month. Huge issue. The number of people that need insulin has doubled from about 2007 to 2020 just in Medicare. And the price has gone from, has increased pretty exponentially over that period of time. A couple other things just to keep in mind, the cost provisions limit annual premium increases. That's important. And it makes all vaccines free for people in Medicare. And maybe folks thought all vaccines are already free. Not so. Things like the shingles vaccine, right? A vaccine that's pretty commonly used by seniors, not free. It would cost you a couple $100. It also expands the low income subsidy program, which is a program that helps low income seniors afford their medicine. Okay, next slide. This law is fantastic. It has an implementation window. So not all the provisions go into effect right away. This little chart just shows when each of the provisions is going to go into effect over the next 6 years. And so some things go into effect right away. The inflation cap goes into effect in a few months, right at the beginning of the coming year. The insulin copay, January 1st of 2023. So 3, 4, 5 months, I don't know, what is that, 4 months from now. And some things are going to be longer. The prescription drug negotiations don't actually start until 2026. There's a bunch of work to do in 2024 and 2025 to set up the mechanism, select the drugs, and establish the sort of system to be able to negotiate. Next slide. And then for people that want more precise dates, this little chart just shows the actual date that these provisions go into effect. So you can see the provisions that go into effect on the 1st of next year. We're almost in the final quarter of this year. People don't have too long to wait until some of this stuff is actually felt. Next slide. I just want to say a word about how Medicare negotiations is going to work. And we don't exactly know because we haven't done this in Medicare before, but we have models because we negotiate in other programs. And so there's a set of criteria that the HHS secretary will have to follow in selecting which drugs get negotiated over. And initially, it's a pretty small number. It's about 10 drugs that are going to be negotiated over. It'll be 10 of the most expensive brand name drugs that have no competition, right? So there's no other way to bring down their price unless we're going to negotiate because there are no competitors. So this just shows you a little bit of the criteria that the secretary is going to be considering before they think about what are the 10 drugs that they're going to select initially for 2026. And then the number of drugs increases over the next few years. So 15 and 2027, 15 Part D and Part B. And the difference between Part D and Part B is just that Part D drugs are drugs that you get at the pharmacy, right? So you get a prescription, you go to the pharmacy. There's about 50 million people in Part D. Part B drugs are drugs that your doctor administers in the office. So if you get a vaccine, for instance, or if you get an infusion of some type of treatment like that the doctor has to administer, that's usually a Part B drug. So one of the expansions in the negotiations is that it starts in just Part D and then also goes to Part B. And then, finally, toward the end of the implementation window in 2029 and later years, it's 20 drugs in Part D and Part B. Some people have asked me, how do we know that the drug corporations are going to negotiate? Well, they are going to negotiate or they're going to face a penalty, right? So there is an excise tax that's a penalty that is built into the law for corporations that refuse to negotiate. And there's also a provision in the law that requires every administration to negotiate from this point forward, right? From the implementation date forward, so 2026 forward. That's really important because we know that it's certainly possible that we would have an administration that didn't want to negotiate. The last administration didn't want to negotiate. So we needed a statute that would obligate every administration moving forward to negotiate drugs, and that it wouldn't be up to the particular president in office, but that this actually would be a law and that all lawmakers would be accountable for enforcing it. Next slide. Here you see 10 drugs seems like a small number of drugs, but keep in mind that most spending on drugs in Medicare is for a relatively small number of drugs, right? The brand name drugs. So the theory behind this law is that negotiating for the most expensive drugs, for some subset of the most expensive drugs, will actually bring down costs. And if if you're in Part D or you have relatives that, in the past have been on drugs like Lipitor or Xarelto, you'll know exactly what I mean. Those are super expensive drugs that, have been expensive for years because there's been no generic competition. Now, because of negotiations, those kinds of drugs can come down in price without waiting for the 20-year patent to expire. Next slide. Next slide. There we go. Okay. This is a little bit about lowering out-of-pocket costs. I'm not going to go through the whole thing because I know people have questions and I'd rather just get to people's direct questions. But you can see here how this legislation lowers out-of-pocket costs, right? What does it do for beneficiaries? What does it do for people in Part D plans? How does it require the drug corporations to cooperate in the process? So the out-of-pocket that people pay is tremendously important because remember, most seniors are on a fixed income, and a lot of seniors for years now have been rationing their medicine. They've been incurring debt. They've been jumping through hoops trying to get really pretty basic medicine. And in some cases, insulin, blood pressure medicine are good examples. They are paying much more today than they were 2 years ago, 1 year ago, 3 years ago for the exact same medicine that they've been taking for a long time. Next slide. I want to mention the insulin cap because it's one of the things that people have talked the most about. In the original legislation, the insulin cap that was proposed would have applied both to people in Medicare and for people with private insurance. And because of the way the reconciliation process works, it was that type of legislation that would apply to private insurance plans was not suitable for this kind of process, for a reconciliation process. Now, Republicans and Democrats could have come together to override the parliamentarian and say, you know what, we want this anyway. And I'll say that there was an amendment, there was a vote in which 7 Republicans joined with Democrats to vote to get an insulin cap for everybody, but 7 votes was not enough. They would have needed 10 votes. So we're going to hear more about the insulin cap. The Democratic leadership is going to bring another bill to the floor, I think in September, to try to get this insulin cap, $35 a month cap on insulin to apply to people with private insurance. Many of you in states, I don't think New Jersey is one of the states, but in many states that we work with, states have actually passed an insulin cap. So really important. The price of insulin has gotten a lot of attention. It is really pretty shocking that in this day and age, we have people dying because they can't get access to 100-year-old medicine whose inventors really thought it should be free to everybody who needed it. Next slide. I want to mention another really important thing in this legislation, and it's very connected to the prescription drug provisions. And you heard me say at the beginning that the prescription drug provisions raise around $280, $300 billion. Part of that funding goes to lower costs for people in Medicare, and part of it goes to lower premiums for people who get their coverage through the Affordable Care Act. And essentially what happened was we extended provisions in a law that it had passed last year, the American Rescue Plan Act, for 3 years, so that people that were getting more affordable insurance through the Affordable Care Act can continue that affordability, and we don't see a whole bunch of people dropping off because their premiums go up. You know, a bunch of the number crunchers have done the research. In addition to keeping the premiums affordable for people, this is going to prevent 1 million people, at least 1 million people, from having to drop their coverage. Next slide. Okay, so I want to wrap with this slide and just say, you know, for those of us that have worked on prescription drug reform and healthcare more broadly for a lot of years, this was a huge victory. I mean, the industry, the prescription drug industry, the pharma lobby is a huge lobby. They have 2.5 lobbyists for every member of Congress. They have gazillions of dollars. They pretty routinely break their own lobby records and their own political donation records. And when this bill passed, they pretty quickly threatened lawmakers that supported the legislation and let lawmakers know that anybody who supported this legislation and has taken away their power to price gouge is going to pay a political price. So, you know, we didn't get everything that we wanted out of them, but this was a big loss for the industry, and they're not going to give up. It's not like they're not going to retaliate. They are going to continue to try to roll back this legislation. And you all in New Jersey may be used to seeing ads from pharma, but anybody today that is pretty much on any website is going to see ads from pharma, essentially trying to scare people about this legislation. You know, the prescription industry lost on this one, and there's more battles ahead with them. Frank's going to talk about taxes, and I just want to flag that there's a lot of great things in the Inflation Reduction Act. not all big industry and special interests lost in this bill. Some had some pretty good victories in this bill. And anytime you're trying to expand healthcare, public services, and rights for workers, you're going to come up against corporate interests and special interests. And sometimes you win, sometimes you lose. But the key thing is we know we have to keep fighting. So I will pause there and turn the floor back over to Maura.
Thanks so much, Margarita. Really a deep dive. I just want people who are following this tonight, who are joining us on Zoom, that these slides have been put together as a lasting resource for you. There's not a quiz tonight. There's a lot of information here, but we hope that what you've heard and what you see will really help you to understand what a powerful victory this is. We have really shifted the power and are holding the pharmaceutical companies accountable, maybe for the first time ever. And that shift is something that will pay dividends for all healthcare patients and all taxpayers for years to come. So it is the first of many things, and we look forward to building on this victory as we move forward. We will be sending these slides out, so stay with us. I'm going to turn it over now to Frank Clementi, who's going to talk to us about the tax provisions before we go into our Q&A.
Hey, thanks, Maura. Great to be here with folks in New Jersey and my pal Margarita. I'm going to start with a slide. Is this the first slide? Okay, first slide, and then I wanted to give you a little bit of historic take on things, but anyway, we'll get that in the next slide. Top lines on the bill. Hey, we know it's going to improve the lives of working families. We just heard it with respect to prescription drugs and the Affordable Care Act. And at the end, I guess you'll learn a little bit more about how it's going to lower energy costs for households. So huge win in this regard. These are historic investments that we're talking about, especially on the climate side. Historic investments on climate, historic change in the relationship of power of drug companies in setting the terms on prescription drugs. It's also fully paid for, which is unusual. But it does it by curbing drug corporation price gouging and by making billionaire corporations and the wealthy pay a fair share of taxes. I will explain more about the tax stuff. To be clear, no one making under $400,000 will pay more in taxes. Republicans have ads out there saying the middle class is going to pay. No. There's no tax increases on anybody below $400,000. And the deficit will be reduced by $300 billion. Many of us wanted that money to go into investments, but Senator Joe Manchin, remember, there was one vote. All it took was one person to block this legislation. Senator Joe Manchin was that person, or Senator Kyrsten Sinema from Arizona. They dictated where we're at. So it was remarkable we got as far as we did. And of course, remember, not one Republican voted for this plan. Rather than supporting working people, they stood with special interests. In 2017, they passed $2 trillion in tax breaks, cuts for the rich and corporations, mostly. Not one Democrat voted for that. It was all Republicans. Now Democrats did our side and voted for this. It wasn't as big, but we started to recoup some of these tax breaks. Next slide. I just want to put it in the historic sense. And we had a major inflection point in the 2020 presidential campaign where we had two candidates, Senator Sanders and Senator Warren, proposing $10 trillion in investments totally paid for by a fair tax system. Candidate Biden proposed $4.4 trillion. Compared to where we were in 2016 with Hillary Clinton, where we have been for decades, that is light years ahead of where things have been. Now, that was a very progressive presidential primary, far ahead of where the Congress was. President Biden came in, he totally delivered on his program. He took the infrastructure stuff out to try and get a bipartisan deal. And so he was left with about $3.3 trillion in investment and paid for revenue and some very progressive tax reforms. We couldn't get that through the House. Senator Manchin, Senator Sinema negotiated with the House before the bill was put on the floor. And so that $3.3 trillion plan was cut down to $2 trillion. The House passed it. All Democrats but one. Huge deal. And then we got the Inflation Reduction Act, which is what it just passed the Senate. And it got pared down considerably more, down to $750 billion, $500 billion in revenue, and $300 billion in deficit reduction. So just to give you some scale, that looks really small compared to where we started, but it's a big deal. Lastly, I want to say about the messaging and the narrative. We won this and it was both about investments and about tax fairness, creating a tax system that pays for these investments. And that's a big shift. We haven't had that kind of debate for forever in the modern era. And so we won that debate. We won the debate in 2017 against the Trump tax cuts, but we won it, and now it's becoming materialized in passing legislation. This is a change in the Democratic Party, honestly, on these issues, and that bodes well for the future if the grassroots activism can stay strong and keep pushing them. All of this has happened because of your activism at the state and local level. Next slide. This, I don't need to run through it, but this simply gives you where the revenue comes from. There's the 15% corporate alternative minimum tax, over $220 billion. IRS enforcement, I'll talk to you in detail about that, $124 billion. And this 1% tax on stock buybacks. Those are the three big revenue raisers, total of almost $500 billion. For you folks in New Jersey, reinstatement of the Superfund tax, $12 billion. That's hasn't existed for like decades. Probably Frank Pallone played a huge role in getting that. I think that there's a lot of Superfund sites in New Jersey, so hooray for that. Next slide. So on the 15% corporate minimum tax, that's what you've heard most about in this debate. The president frames it up, Democrats have framed it up. We're minimum tax on corporations, and that's what's paying for the energy. Some people say that's what's giving you the deficit reduction. Some folks say that's what's delivering the clean energy. I kind of prefer the latter. It's got effects about 150 corporations. First of all, the reason this is being put in place is because you've all heard the stories about 55 corporations, major corporations that didn't pay any taxes in 2020, or others that pay 5% tax. That's why this is here. This was a big deal for President Biden, and Senator Elizabeth Warren actually was extremely instrumental in getting this passed. Affects 150 corporations. They have $1 billion in profits on book income. That's the income they report to their shareholders. Corporations report record profits to shareholders, but they pay a lower tax rate than nurses, firefighters, and teachers. The average tax rate for regular working folks is 13%. This goes a little bit above that, but if you can believe it, a company like Amazon, billion-dollar corporation, some years it pays nothing. If you've paid income taxes some year, you yourself pay more than Amazon pays. Just this gives you some idea of how much is going to come in from these companies. As I said, it raises $220 billion to pay for historic investments in clean energy. Next slide. IRS enforcement. So I'm sure you've heard this from the Republicans. They're like going after it's 80,000 armed IRS agents are going to be auditing. They're going to come to your home. They're going to come to your small business. They're going to make you pay. Bull. We're going to get you more on this in the coming days. This reform is historic. IRS right now spends about $14 billion a year. This is adding $8 billion a year. So it's about a 65% increase, 2/3 increase in the IRS budget. It will bring it into the modern age, hire a lot more auditors, and they're all focused on targeting the wealthy and corporations. The richest 1%, they are not paying $160 billion a year in taxes that they owe now. We're not talking about the loopholes. We're simply talking about what the tax law is now. They're not paying $160 billion that they owe. That's going to hopefully change. Audits of millionaires are down 71% since 2010. Audits of large corporations are down more than half since then. Secondly, customer service. I mean, how many people are bummed out because they haven't gotten their tax refund from the previous year or 2 years, or they can't get their IRS phone call answered? So huge increase in customer service representatives to help all of us, and big technology system reforms, which will produce a lot more revenue as well. Raises $124 billion. The Treasury Department estimates it could raise as much as $400 billion. And just to be clear, there will not be an army of 87,000 agents coming after you. If you make under $400,000, you have no problem whatsoever. Next slide. So you may have heard that there's a 1% tax on corporate stock buybacks. I don't know how much people pay attention to stock buybacks. A lot of corporations, especially drug corporations, they distribute, they've got a lot of profit, a lot of cash. They could be investing it in higher pay for workers. They could be investing it in expanding their operations. But what they're doing instead is giving it in stock buybacks, $5 billion, $10 billion a year. Stock buybacks, they jack up the price of the stock shares. That means money straight in the pocket of the CEOs and wealthy shareholders. Remember, 1%, the richest 1% owns more than half of stock in this country. The top 10% owns 90%. Why do they like doing buybacks? Because they are not taxable. They can just, your Apple stock goes up and it's not taxed. It's not taxed until it's sold. These people are so rich that they just pass it on to their heirs and the heirs get it. They don't actually have to pay taxes on it. So that's key. This now, it will be taxed. It'll either be taxed because it'll have a 1% tax on the buybacks, or the company will decide, well, we'll give it in dividends, and the dividends get taxed. As I said, it raises $75 billion. The beauty of this thing is once it's in place, we can dial it up. Every percentage point, we can raise another $75 billion. And so, we want to expand healthcare. We want to expand childcare. We can go to the excise tax and say, let's raise it higher. Next slide. I'm going to leave you with messages. We are just next week going into the field with a poll where we're testing a lot of messages on how to sell the IRA, the Inflation Reduction Act, how to respond to Republican attacks on the Inflation Reduction Act, what the Republican attacks are on the IRS spending increases. All of that's being tested, and it'll be distributed widely through our network, through Citizen Action, et cetera. We're testing many different messages. We'll be able to compare how they do. Some of the messages are simply the investments tested against the tax messages. But we're very optimistic that our messages will test well. It'll give some great talking points to close out the year on how to talk about this. The kind of thing you can take to your elected officials and say, hey, these are tested. It's Biden's pollster is our pollster. And this is what we found. Please start using these messages, work them into your stump speech. Think about putting them into your ads, that sort of stuff. So I'll leave it there.
Thanks so much, Frank.
Well, let me just say, don't take those messages to the bank yet, because the poll, we think they're going to be our better ones, but we don't have the results. But, I feel pretty confident about it.
Yeah. Thanks so much. I think you will be proven right. We'll look forward to receiving more information once that poll is complete. And one of our goals tonight is really to help people kind of see how vast and how impactful this law really is, and to arm themselves with better information so that they can talk to their friends, their family, their neighbors, and others about what this really does. Across the board, we are going to see lower costs lower prices, which all equates to more access to people. You know, when we go to the pharmacy and what we're having to put out of pocket is less, that is helping me, it is helping the community, it is helping me to be able to invest that money in something else and help make ends meet. Critically important for people who are having to rely on these drugs that have just been a runaway freight train for years and are having to cut their prescriptions in half or going without them. It's really about time that we began to tackle this industry that has been so out of control. And here in New Jersey, we are working on state reforms. We are one of the states that is working to institute some reforms that will actually build on the success of this federal law. Governor Murphy has proposed an insulin cap, and there is a bill in the New Jersey legislature to do that, as well as to establish a prescription drug affordability board that will help to institute some similar reforms that you're seeing at the federal level here in New Jersey. So stay tuned for all of that. We do have one slide, which we have included, and it will be in the deck, on the climate provisions. The biggest investment that this country has seen in clean energy, really just to summarize it, because we want to go to Q&A, the Inflation Reduction Act makes a significant and historic investment in expanding access to green energy. Their mechanisms of tax credits and rebates will help homes, businesses, state and local governments accelerate the shift to more efficient energy systems and use. Something critically important here in New Jersey, as we have seen the devastation of climate change through the multiple floods that many communities across our state have faced, the increased flash flooding that we see, and all of the impacts that we are seeing on our coastline. So all of that is addressed in this bill, and we are going to see many jobs created from that. New Jersey is well positioned from the work that the Murphy administration has done to really capitalize on this, and you will see a significant investment in these in the climate change technology as we move forward here in New Jersey and across the country. So with that, we want to move to Q&A. We have a few questions that have been put into our Q&A queue. And the first one comes from Sue Coleman, who has joined us tonight via Zoom. And Sue has a question on prescription drugs. She is asking, you know, we are hearing from opponents that the drug pricing and the negotiation provisions, pharma is claiming, they're claiming that pharma will make up the profit loss by increasing drug pricing for private insurers and working families. So Margarita, how would you respond to this kind of a concern?
Well, first I would say one man's claim is another man's threat. You know, listen, that's a blatant threat from the prescription drug corporations that they are going to punish consumers because they no longer have the power in Medicare to charge whatever they want. And that's a big deal for them, right? Because Medicare is the nation's largest purchaser of prescription medicines. I will say, it sounds more on the threat side to me. Listen, that is not different than what the prescription drug corporations have always done, right? Americans already pay twice as much for prescription drugs as people in other countries pay for those very same drugs. The prescription drug corporations already raise prices, you know, faster than the rate of inflation. They already have unreasonable, ridiculous launch prices. $60,000 a year for a new Alzheimer's drug. So yes, I mean, I think the prescription drug corporations in making those threats are not telling us anything that we don't know, which is that they are going to try to make up profits by doing a series of other things that cost shift to consumers. And they're going to try to do that so that they don't have, so they can maintain their inflated profit margins. Here's the most important thing to remember. The prescription drug industry isn't just a profitable industry. We're not talking any old industry here. It's the most profitable industry in the S&P 500. And it could lose $1 trillion in profit over the next 10 years and still be the most profitable industry in the nation. And so really it's up to us, right? My last slide essentially said, you know, some people won, some industries won, some lost. But the reality is to make this win a real win, we have to keep pushing back on the industry. And it means that we can't stop with Medicare. We need to go back and get the reforms in private insurance that we tried for in this bill and weren't able to get. And we're well positioned to do that because when it comes to the prescription drug corporations, they have no allies. Consumers don't believe them no matter what they say, because they have done such a terrible job at actually maintaining their credibility. So, you know, maybe that stuff will happen, maybe not. But on the other hand, it's been happening. And the only answer is to really regulate them and take away their power to punish consumers and to keep raising their prices.
Thanks for that, Margarita. Similarly, we have a question on the tax side that's kind of mirrors this, Frank. If big companies like Amazon and FedEx have to start paying more in taxes, does this mean we can expect to see an increase in the prices consumers are paying?
I mean, it's a marginal amount that's added to the bottom line. So I don't think we have anything to worry about. If we got the whole big agenda passed on corporate taxes, maybe there'd be some effect on prices. But, you know, people may not realize American corporations have record profits. They've had record profits through the pandemic, even many of them. And really for years, they've had very record profits. I mean, we got a report coming out next week on Starbucks and its union busting. Starbucks is there over the last, since the Trump tax cuts passed, their tax rate went from 28% down to 18%. Okay. And, you know, it just fed the bottom line, just more and more profits going to them. You know, the workers they got a $300 pay hike in the last year, 2.3% with inflation of 5.5%. So it's just, you know, so many of these corporations that aren't paying taxes or that are, you know, maybe you're paying whatever limited. There's so much room for them to pay more taxes, and when you spread it out, the impact on the price of goods and services is going to be negligible, if not minimal, depending on how much we raise it. But the way to think about it is, how much does that bring back to us in terms of what the federal government can deliver to our communities? People may not realize it, but your state budget is, I don't know the exact percentage, but the average state budget is 1/3 funded by the federal government. Okay, this is money that flows from Washington to housing, to childcare, to Medicaid, to Title I, to IDEA education. I'm not talking about money that goes to Social Security and Medicare. I'm talking about money that flows to your communities from the federal government. And if we raise, you know, $1 trillion at the federal level, New Jersey's, well, actually, we just did an estimate on this. If we were to pass a billionaire's income tax, the version that Senator Ron Wyden proposed, that is estimated to raise over $500 billion, that would increase the amount going to most state budgets by 2 to 3%. So your New Jersey budget, I don't know what, let's say it's $100 billion a year. That would be a $2 to $3 billion increase to your state budget potentially flowing through. So we're talking huge sums of money with these increases. Don't think that it goes somewhere. Largely it goes to the state and locals because that's how the economy works, right?
Yeah, well, I really appreciate you making that link, because oftentimes we talk about state, federal, and local budgets in silos, and it is one system overall. I mean, New Jersey relies heavily on the support that we get from the federal government. During COVID, we saw an increase in support for a number of our safety net programs and things that enabled us to do more for the people of New Jersey. And as that money comes in, New Jersey and other states will be able to do more because we are getting the support from the federal government. And not only that, but we are looking not to remake the entire system. You know, companies will still be making profits, but they will be paying what they owe, as opposed to skating out of any responsibility. So we really, really appreciate those comments and the context in which you put it. Just one brief question, and then I'm going to move us kind of quickly into an overview of what people can do and what you can expect moving forward by turning it over to my colleague, Montahina. But we had one question, and I myself was not clear. I think I know the answer to this, but Margarita, someone was asking for clarification. Will the prescription drug reforms apply to Medicare Advantage?
Yes, yes. And keep in mind that Medicare Advantage is almost half of, almost half of Medicaid enrollees are enrolled at this point in Medicare Advantage plans. In fact, there was an article out today that by 2023, it will actually be half. And a lot of people get their Part D plans through their Medicare Advantage plan. So whether you're in traditional Medicare or you're in an Advantage plan, the prescription drug reforms will apply.
All right, great, thank you. I'm going to introduce now, I'm going to turn this over to Montahina Deal, who is our digital organizer at New Jersey Citizen Action. We've really put some thought into, we wanted to brief you on this. We wanted you to hear a little bit more than what you're reading in the daily paper, but we also wanted to give you some tools that will help you to really wrap your head around this and be able to talk to other people and share the information with them. So I'm going to turn it over to Montahina, who's been helping us on all of this presentation to go over what it is that you can do to take action and to continue to work with us to spread the word about the Inflation Reduction Act. Montahina?
Hi, everyone. My name is Montahina. I am the digital organizer for New Jersey Citizen Action. And I just wanted to quickly share with you guys a social media toolkit that we put together. And I'll just briefly run you through it. We will be sending this out to everyone who's joined us today or signed up for this event via email tomorrow, along with all the slides that you guys saw today. But this is essentially the toolkit. A lot of this information is already put together for you. So there's right now a lot of misinformation about the Inflation Reduction Act. So this is basically how you can take part in spreading awareness about what the Inflation Reduction Act actually does. So there's some brief posts. Again, we ask that you personalize these posts just so we get more engagement and also so you have an opportunity to share your own stories. We also have graphics here. Again, feel free to use them, but also include your own pictures, either of yourselves or your families, anything that you might have come across on the internet as well. And then below we have links to our social media, including Americans for Tax Fairness, who joined us today, Lower Drug Prices Now, and Healthcare for America Now, who also joined us. But again, this will all be shared to you in an email going out tomorrow.
Thanks, Montahina. And I just wanted to mention, we have a link in the slides that you will get tomorrow to be able to sign up with Citizen Action to continue to stay engaged, to get information, and to be able to take action, not only around these issues, but several issues at the state level that will build on the things we're seeing at the federal level. Like I had previously mentioned, the effort to bring a prescription drug board here to New Jersey that will enable us to do some of the very things we're seeing happening at the federal level. We're also aware that not everything that we had hoped would be included in a package that came out of Congress actually made it. And we at Citizen Action work on caretaking issues, helping families to have what they need to take care of their families, their children, to have access to paid family medical leave. And so that's something that was not able to get through in this package, but we are continuing to work with our state and national partners to see national paid leave and care worker protections, childcare and pre-K actually a reality. So many families are in need of a more affordable way in which to be able to work and care for their families. So we have a link here. You can also sign up to stay engaged and get information on the fight for caregiving policies. Lots of work to do. We just really thank you for your time tonight. We hope that you found this useful, and please stay in touch. Make sure you sign up for our email list if you are not already on it. As we move forward in the coming months, we will be doing more events like this and would love to work with you to bring the word further to those in your community. So thank you to Margarita and to Frank and to our entire Citizen Action team for this event tonight. And we really appreciate you joining us. Thanks so much and take care. Bye-bye.